Hi, hello friends, good morning. Welcome to our channel, The Voice of Nurse. Today we are going to discuss first aid part 2, first aid related to the frequently asked questions and very important questions and answers. We already discussed in part 1 introduction of the CPR and objectives, aims, purposes of CPR and indications, types of CPR. In briefly we discussed about CPR procedure and first aid kit related to the equipments and medications. Along with introduction of the CPR, these many things we already discussed, plus 30 questions and answers with explanation already finished. Today we are going to discuss part 2 from the 31 to 60 question we are going to discuss in this video. Before moving on to topic, a small request friends, anybody watching first time my channel, please subscribe my channel, click on the bell icon for further notification. Please like a video and share the video to your friends. Give your opinions in comment section. Let's move on to topic. Now we are going to discuss part 2 in the first aid topic. From the 31 to 60 question we are going to discuss now. While performing CPR, an infant, second person arrived at the scene. What do you do next? We will see here options. Option A, shift the patient immediately. Option B, second rescuer begins ventilation. Option C, second rescuer help with CPR. Option D, IV line to be secure. Here in this question, CPR is going on to a infant. Second rescuer arrived at the scene. The second person, what they have to do? We will see here options. Shift the patient immediately and rescuer begins ventilation. Second rescuer help with CPR and IV line to be accessed means secure means here once rescuer performs cycles of 30:230 compressions and 2 rescue breaths. When second rescuer arrives perform cycles 15:2 means 15 chest compressions and 2 rescuer breaths. Detailedly I will explain here. The ratio of 2% CPR cardiopulmonary resuscitation for infants and children is 15:2. 1% CPR for the all ages is 13:2. But person CPR ratio and means the second rescuer person came to arrive in the scene means CPR ratio for the child and infant will be 15 compressions and 2 rescue breaths. Here as soon as possible, use of AED as soon as possible, it is available here. So here option C is the correct answer. Second rescuer help with CPR. Second rescuer have to help to first rescuer when they giving CPR procedure. Here option C is the correct answer. Next we will move on to question number 32. If a victim is not breathing normally, what is the first thing you should do? We will see here option. Before options, we will discuss regarding questions. Victim is not breathing normally means suddenly one person is not breathing correctly. The first thing, the behind person, what they have to do. Option A, give rescue breaths. Option B, start chest compressions. Option C, call for emergency for medical help. And option D, check pulse. The calling for help is the first step in chain of survival. For victims of a cardiac arrest in adults, call 911 first and do the following. If the person is not breathing but has a pulse, give first rescue breath every 5 to 6 seconds or about 10 to 12 breaths per minute. Here in this question, victim is not breathing normally and the first thing should do, call for help, call for emergency for medical help. Option C is the correct answer here. In case there is no pulse, so immediately within 10 seconds we have to check the pulse and immediately they have to start CPR. So here option C is the correct answer. Next we'll move on to question number 33. How should you open an airway in an unconscious adult victim? Here adult victim is adult unconscious. How we will open an airway in unconscious patient? We will see first option. Option A, tilt the head to the side. Option B, tilt the head back and lift the chin. Option C, call for emergency for medical help, and option D, none of the above. When a person is unresponsive or unconscious, their muscles relax and their tongue can block their airways, so they cannot no longer breathe, they cannot take longer breath. So here we can use the method tilt the head and back, tilt the head back and lift the chin, also called as jaw thrust method. Jaw thrust method is also called as head tilt and chin lift method. Assess for any visible obstruction is there in airway and clear airway by removing any loose obstruction from the mouth and pharynx like mucus, blood, foreign body. In case of unconscious victim, tongue is most common cause of airway obstruction. If the victim is still not breathing, then open the airway by head tilt and chin lift or jaw thrust method. Here I have to mention one thing, note will be there because head tilt chin lift method. Here we are having note. The jaw thrust is a technique used on patient with suspended in spinal injury and used on a supine position. If the victim still not breathing on his own after airway also, we can go for assist him breathing. So here option B is the correct answer. Next we will move on to question number 34. Burns are classified by degrees from 1st to 3rd degrees. Which of the following is 3rd degree burn from the following? We will see here option A, burn area is 10% of body. Option B, burn area is 5 inches across. Option C, burns extends through all the skin layers and tissues. Option D, burned area is red and no blisters. All deep burns require treatment to prevent infection and scarring. 3rd degree burns are the most serious type, can be life-threatening burns. However, 1st and 2nd degree burns are also more painful. We will see classification of burns in briefly. 1st degree burns. The 1st degree burns are superficial burns, affects only the epidermis or outer layer of the skin. This is primary burns. Secondary burns. Secondary burns is more serious burns that affect layer in the dermis. In primary, the 1st degree burns, in primary burns, it is effect in the epidermis, and 2nd degree burns is affected to the layer of the skin is dermis. This is 2nd degree burns. The 2nd degree burns is mild to moderate burn. Next, what is 3rd degree burns? 3rd degree burns are referred to as full thickness of bones. 3rd degree burns destroy the epidermis and dermis. Here in primary means the 1st degree burn is involved in epidermis, the 2nd degree burns are involved in dermis, but in 3rd degree burns are involved destroys in epidermis and dermis. So here option C, burns extends through all the skin layers and tissues. Next we will move on to question number 35. A possible brain damage might happen how long after patient stops breathing? Means here the patient is stops breathing, then how much long time the brain will damage after stopping a breathing. Here we will see option A 6 minutes, option B 2 minutes, option C 4 minutes, option D 10 minutes. The time is very important when an unconscious person is not breathing. Permanent brain damage begins after only 4 minutes without oxygen, and death can occur as soon as possible 4 to 6 minutes later. So, brain damage is a medical emergency. Some of the conditions like drowning, choking and suffocation, cardiac arrest or head injuries. Cerebral hypoxia can kill brain cells and lead to brain damage and death. So here the possible brain damage might happen, the how long after the patient stop breathing, here means option C, the 4 minutes is the correct answer. Time is very important, is unconscious patient is not breathing means immediately we have to check the pulse in that patients, and then and there only we have to start CPR. So here within 4 minutes the brain death will happen after stopping of breathing. Next we will move on to question number 36. What is the first step to do when you are sprained in ankle? Here the first step to do when the client is having sprained the ankle. Options: Option A, rest with elevated leg. Option B, apply ice. Option C, massage. Option D, pressure. Try to ice the area as soon as possible after the injury and continue to ice it for 15 to 20 minutes. So here, after sprain the ankle, we have to try ice the area as soon as possible. Approximately the time duration is 15 to 20 minutes. We have to do 4 to 8 times for a day for the first 48 hours or until swelling improves. Here note, if you use ice, be careful not to use too much of long time. Duration should be 15 to 20 minutes. If you are using more than the time, means the cold causes the tissue damage. So we have to apply the ice as soon as possible, 15 to 20 minutes of time duration only. So here, after the sprain the ankle, the first step is apply the ice. Here management is first 2 to 3 days rest, ice application to be done, and compression the area, elevation to be done. Here option B, apply ice, is the correct answer. Next we will move on to question number 37. What is the correct order of ABC in the CPR process? What is the correct order of airway breathing circulation in the CPR, cardiopulmonary resuscitation process? We will see first options. Option A, airway breathing compression. Option B, circulation, airway breathing. Option C, airway breathing circulation. Option D, none of the above. In the cardiopulmonary resuscitation comprise 3 steps. What are there? We will see now. These are CAB, chest compressions, airway breathing. So here the chest compressions, airway breathing. Chest compression can help the flow of blood to the heart, brain and other organs. Cardiopulmonary resuscitation begins with 30 compressions followed by 2 rescue breaths. Here option B, circulation, airway breathing is the correct answer, but here not circulation, chest compression. Push hard and fast on the center of the victim's chest. This is the compression, 30:2. We have to maintain a ratio. Airway, if patient is not taking breathing and airway is blocked, means tilt the victim's head back and lift the chin to open the airway, means jaw thrust method. What is B? Breathing. Breathing gave mouth to mouth rescue breaths. So here option B is the correct answer. Here we can see in this picture advanced life support, CPR, cardiopulmonary resuscitation in easy way. CAB, chest compression, means C for compressions. It will be chest compressions. A means airway, B means breathing. So here CAB means chest compressions, airway breathing. Next we will move on to question number 38. How to recognize a patient with a fractured skull? Here patient is having fracture in the skull. So how you will recognize? We will see options first. Option A, patient is having blurred vision. Option B, having severe headache. Option C, watery blood or clear fluid from the ears or nose. Option D, unconsciousness. If a person experiences ear bleeding as a result of head injury, trauma or sports injury, in this situation, they need immediate emergency medical attention. Ear bleeding after hit or blow to the head could be from the bleeding from the brain. In this situation, medical emergency, there is a risk of brain damage. So, immediately we have to take a medical attention or call 911 for the emergency. Shift to hospital immediately. In case victim or client is having watery blood or clear fluid coming out of the ears or nose, from the ears or nose may be result from the skull injured. So here the recognition of patient with fractured skull means option C, watery blood or clear fluid from the ears or nose. Here option C is the correct answer. Next we will move on to question number 39. Breathing emergencies may be caused by. Breathing emergencies also one of the first aid. So here breathing emergencies mainly caused by options. Option A, asthma or allergic reaction. Option B, pulmonary hypertension. Option C, injury to the muscle or bone in the chest. Option D, all of the above. Some emergency causes of breathing problems includes trauma, pulmonary hypertension or high blood pressure that affects the lungs, and life-threatening allergic reactions. In this situation, the first aid treatment: if someone is having breathing difficulty, call 911 or your local emergency number right away. Then check the person airway, breathing, circulation. So person is not taking breathing, there is no breathing, so then only we have to start mouth to mouth rescue breaths. So immediately we have to start a mouth to mouth breath. Head tilt and chin lift manner we can use. We can do a airway and breathing. So here all of the above. Breathing emergencies may be caused by asthma or allergic reaction, pulmonary hypertension, injury to muscle or bone in the chest, trauma and high blood pressure. So these all are the breathing emergencies. Option D, all of the above is the correct answer here. Next we will move on to question number 40. What the 3 steps are involved in CPR? Here the 3 steps is involved in cardiopulmonary resuscitation. We will see options. Option A, check, call, care. Option B, call, check, care. Option C, call, care, check. Option D, none of the above. 3 C's to save a life. 3 C's means check, call, care. These are the 3 C's to save a life. Check for responsive. Option A is the correct answer here. Check for responsiveness. How? Shake the person and shout, "Are you okay? Are you okay?" Like that we have to check the patient response. Next, call. Call someone to help and someone to call 911 number. Make the call yourself if the person is unresponsive and the second person is not available there and person is struggling with breathing, then only we have to inform the medical care facilities. Next, third one is care. Here check, call, care. Care will be compressions. Compression begin forceful chest compressions at the rate of 100 per minute until emergency team to arrive the area. Means here option A is the correct answer. The 3 steps are involved in cardiopulmonary resuscitation is check, call, care. Option A is the correct answer here. Next we will move on to question number 41. There are many people with serious injuries in a sudden crash. Who should you give a first preference for a first aid? So here the sudden crash was done. So many victims is in serious injuries. So here the first preference for a first aid person. Who will give first preference means here we will see options. Option A, who is having minor bleeding. Option B, who is suspected injury. Option C, who is not making any noise. Option D, who is having more pain. We have to give first aid to who one is not making any noise. Immediately observe breathing, check the pulse and start chest compressions in 30:2 ratio. And also the second priority in this situation, we can give a first aid for the suspected injury. Here most probably some of the patient is having neck injury. In this situation we can give a second priority to this neck injury patients. So here option C, who is not making any noise, we have to give first preference for a first aid. Next we will move on to question number 42. What first aid should you give someone is having heart attack? So here someone is having heart attack. What is the first aid you have to give? Here we will see option. Option A, call emergency number. Option B, perform CPR, cardiopulmonary resuscitation. Option C, check the pulse. Option D, all of the above. Here someone is having a heart attack means immediately we have to call emergency number 999 or 112 for emergency help straight away and tell them or give information to them someone is having a heart attack here. Then come back to the scene. You have to keep a patient in sit down or in back, rest the patient and try to keep calm, loosen any tightened clothing is there, and ask the person takes any chest pain medication in previously or not. We have to ask the person. Then if patient is not taken, we have to help them to take a medicine. So here in first aid we have to sure someone is having heart attack means we have to call emergency number and check the pulse, perform CPR. So all of the above is the correct answer here. Next we will move on to question number 43. What would be best to hold to someone's head if they have post injury? Means here someone is having head injury. After the head injury post treatment, what you will give a best hold to someone head? We will see here options. Option A, wrapped in a tea towel. Option B, elevated bed. Option C, head upright. Option D, cushion. You can hold a cold compress to a head injured client. Try a bag of ice or wrapped in a tea towel. Wrapped in a tea towel, keep it in hair in place and make it easier to refresh and reduces discomfort and reduces the pain. So here the best to hold someone's head post injury, wrapped in a towel. Option A is the correct answer here. Next we will move on to question number 44. What should be done for a snake bite? What should be done for a snake bite? After snake bite, what we have to do? Option A, apply a tourniquet. Option B, suck out the venom. Option C, cut the wound with knife. Option D, wash with soap and water. Immediately move away from the area. Here when the snake bite will happen, immediately then and there only we have to move away from the area, lay or sit down with a bite in a neutral position of comfort. Remove rings and watches before swelling start and wash the bite with soap and water. Clean the bite with a clean dry dressing. Then victim should go to hospital immediately and they have to move on to emergency department for the further management. So here the for snake bite, the first thing we have to do here, wash with soap and water. Option D is the correct answer here. Next we will move on to question number 45. Which one is efficient dressing from following? Which one is efficient dressing from following option? Option A, with germs. Option B, germ free. Option C, normal bandage. Option D, with moist. A dressing is protective covering applied to a wound to control bleeding, prevent infection, observe discharges and reduce pain and avoid any further complication. So an efficient dressing should be sterile or germ free. So the dressing come into the range of sizes means the treatment wound dressing is all sizes. So here efficient dressing from following is germ free is the correct answer. Sterile dressing, germ free or sterile dressing. So here option B is the correct answer. Next we will move on to question number 46. A severe headache along with black eyes may indicates to. So here severe headache along with black eyes may indicates to. We will see option. Option A, heart attack. Option B, serious head trauma. Option C, just a simple black eye. Option D, confusion and or fracture. A black eye is also known as periorbital hematoma. Black eye may be represents a facial fracture if headaches persist or if you experience a loss of vision or consciousness. Black eye may symptoms of confusion or fracture. Here the conclusion is traumatic brain injury that affects your brain function. So here the severe headache along with black eye may indicates to patient is having the symptoms of confusion and or fracture in the facial bone fracture is there. So here option D, confusion or fracture is indication for the severe headache along with black eyes. So here option D is the correct answer. Next we will move on to question number 47. How can you attempt to remove insect from the ear? Here insect is in present in ear. How you will remove, or how you will attempt to remove the insect from the ear? We will see option A, blowing into opposite ear. Option B, pick it out with tweezers. Option C, shaking the head until it falls out. Option D, flooding the ear with water. In most cases, a bug entering in the ear is harmless. However, if a bug enters into the ear and not removed, an infection could be occur for a long time. If the object is an insect in the ear, means pour warm but not a hot oil into the ear. Oil can be mineral oil, olive oil or baby oil. Pour warm water, not hot, not more hot water, only warm water. The insect should float out. In hospital instruments we can using the removing insect with a alligator forceps we are using to remove the insect in the ear. So here the attempt to remove insect from the inside of the ear is flooding the ear with water so that it floats out. So here option D, flooding the ear with water, warm water. Here option D is the correct answer. Next we will move on to question number 48. The first identification of a person who is having consumed poisoning. So, person is consumed poison. The first identification we will see here option A, dilatation of pupils. Option B, person expressions. Option C, constriction of pupils. Option D, person falling asleep. All poisoning are serious. Some poisoning requires immediate attention before calling for help. So here all poisons are serious. Some poison require immediate attention. But before calling for help, check labels for first aid information. So we have to check a labeling of the oil or poisoning bottle. Then we have to check for what is the first aid treatment we have to do and follow it immediately. Poisoning affects the nervous system, causing drowsiness, delirium, coma or loss of consciousness. Depending upon the toxins, means depending upon the different types of poisons is there. So depending upon the poison toxin, so the first identification of person poisoned is falling asleep or drowsiness. So here option D, person will falling asleep. Option D is the correct answer here. Next we will move on to question number 49. In casualty, received a patient with chemical burn to one eye. How should you do a sterile dressing? So here casualty we received patient with a chemical burn into the one eye. How should you do a sterile dressing? We will see here option A, cover both eyes. Option B, only cover injured area, means injured eye. Option C, no need of dressing. Option D, none of the above. First, after any chemical burns, we have to keep the area in the running water. So here the eye is injured with the chemical burns. So keep the eye under the running water for at least 20 minutes. Make sure contaminated water do not use. Then call 999 for the medical attention. Cover the burn using the sterile bandage or sterile cloth. Reduce risk of infection. Sterile bandage or damp pad dressing to be applied only the injured eye. And treatment can be topical antibiotics to reduce the risk of infection, and maintain full of sterile techniques while touching the area of the eye, and while during the dressing we have to maintain a sterile techniques. So here the casualty received patient with a chemical burns into the one eye, the sterile dressing to be applied to the only injured eye. So here option B is the correct answer. Next we will move on to question number 50. When performing CPR in ambulance, when should you stop? So here CPR is performing in ambulance. when they have to stop a CPR. We will see here option A after 5 minutes, option B after 10 minutes, option C only when assistant has arrived, option D after 15 minutes. Keep his or her airway open and continue to monitor person breathing and for any changes in breathing person condition until emergency personnel can take over to continue CPR. Ideally, you should not stop CPR until the victim revives, and criteria for when the stop CPR. We are having some of the criteria or guidelines for termination of resuscitation is return of spontaneous circulation, arrival of rescue team or medical help, and death is confirmed. These three times means there are the three guidelines or three criteria to terminate the resuscitation. So here only when assistance has arrived at the scene, then only they have to stop a CPR. Next we will move on to next question number 51. What is the main goal when treating a fracture victim? The main goal treating the fracture victim. We will see here option A reduce pain, option B prevent swelling, option C immobilize and support, option D increase complication. So here the main goal when treating a fracture patient, stop bleeding by applying the direct pressure to the wound with a sterile bandage and clean or sterile cloth or clean piece of clothing. Immobilize the injured area and other goals like prevent infection, achievement of the bony union and the restoration of the function. So here the main goal to treating the fracture person victim is immobilize and support. Here option C is the correct answer. Next we will move on to question number 52. CPR involves cardiopulmonary resuscitation involves. We will see here option A chest compressions and rescue breaths, option B abdominal thrust and chest compression, option C rescue breaths and ventilation, option D all of the above. CPR cardiopulmonary resuscitation combines rescue breathing means mouth to mouth breathing and chest compression to temporarily pump enough blood to the brain until specialized team is available. Cardiac arrest is not the same as heart attack. Both are different. Heart attack is different. Cardiac arrest is different. A heart attack happens when blood flow to the heart is blocked. In that situation, heart attack will happen. So here the CPR is involves here chest compressions and rescue breaths. Option A is the correct answer here. Next we will move on to question number 53. DRSABCD stands for. What is DRSABCD? We will see here option A danger response send, option B airway breathing, option C CPR cardiopulmonary resuscitation and defibrillation, option D all of the above. Here in this first aid is as easy to ABC means airway breathing circulation. In any situation we can apply the DRSABCD. This is the 7-letter acronym for the first aid. So here DRSABCD stands for danger response send, airway breathing and cardiopulmonary resuscitation and defibrillation. So here all of the above is the correct answer. DRSABCD means danger response send, airway breathing, cardiopulmonary resuscitation, defibrillation. Option D all of the above is the correct answer. Next we will move on to question number 54. What is the meaning of asystole? What is the meaning of asystole? We will see here option A loss of consciousness, option B no respiration, option C loss of electrical activity in the brain, option D flat line. Asystole represents the cessation of electrical and mechanical activity to the heart. So here asystole means flatline. Option D is the correct answer. Asystole is a type of cardiac arrest which is when your heart stops beating entirely. Usually makes pass out. The word using in the hospitals is pass out. The asystole is also called as flatline. The meaning of asystole is option D, flatline. So here option D is the correct answer. Next we will move on to question number 55. What is PEARL? What is PEARL? Option A, pupil equal and response to light. Option B, pulse equal and reactive to light. Option C, pulse equal and response to limbs. Option D, pupils, ears and reactive to light. PEARL is the first aid acronym used when assessing head injuries and brain functions. PEARL means pupil equal and reactive to light. So here option B is the correct answer. The first aid acronym PEARL is used when assessing head injuries and brain function. When a casualty eyes are open or light shown in them, their pupils should respond to light by shrinking. If they don't react or react unequally, then there is like problem in the brain. So this is the identification and assessing the head injuries and brain function. So here PEARL option B, pulse equal and reactive to light is the correct answer. Next we will move on to question number 56. Which drug should offered to a victim having heart attack? Here the victim is having heart attack. Which drug is offered to them? Option A, aspirin. Option B, salbutamol. Option C, adrenaline or epinephrine. Option D, all of the above. The drug is offered for heart attack is aspirin. Aspirin is used for victims having a suspected heart attack. The early administration of aspirin has been shown to improve survival. Aspirin, a acetylated salicylate, is classified among the non-steroid anti-inflammatory drugs NSAIDs. Now studies shown that because aspirin thins off the blood, it can also help to lower the chances of heart attack or stroke caused by blood clot in the brain. So here the drug should be offered a victim is having heart attack means option A, aspirin is the correct answer. Next we will move on to question number 57. What is the correct order from the following steps? Here in the first aid, in the emergency situation, what we have to follow a steps. Option A, call 911 or emergency. Option B, check the patient's airway. Option C, begin CPR. Option D, check pulse. Option E, place the victim on his or her back. Option F, E, A, B, D, C. When a person suddenly unresponsive or unconscious, otherwise anyone who has suddenly ill, mean that situation we have to follow the steps. Place the victim on his or her back, call 911 or inform someone about situation. Next, check the patient's airway, check the pulse. Next, begin. If there is no pulse, immediately we have to start a CPR. So here the steps is EABDC. All the steps is correct, but according to the correct order is EABDC. Next we will move on to question number 58. What is faint? What is meaning of faint? We will see here option A sign of fear. Option B, a sign of flu. Option C, stroke. Option D, a brief loss of consciousness. What is faint? Faint means fainting. Fainting is when someone is briefly becomes unresponsive because there is not enough blood flowing to the brain. When someone faints, their pulses will slow down but usually picks up and returns to the normal soon after the sometime. The fainting. What is the cause of fainting? Fainting is caused by sudden drop in blood pressure. For example, for the fainting is cardiac syncope. The first aid treatment for the fainting: lay the person soon afterward in the flat on their back. Lay the person in the flat on their back. Elevate the person's legs to restore blood flow to the brain. Loosen the tightened clothing means dress. Dress we have to lose, because if we are losing the tight cloth means the improvement of breathing will be there. So here the faint means option D, a brief loss of consciousness is the correct answer. Next we will move on to question number 59. What are the requirements for a cover bandage? What are the requirements of cover bandage? We will see here option A, it may be older than 1 year. Option B, must be sterile. Option C, it may not be observed any fluids. Option D, all of the above. What is cover bandage? Cover bandage means a strip of fabric used especially to cover the dress, means cover the area and build up wounds. A bandage must be applied with sterile techniques, and non-sterile individuals should never reach over the sterile field. So here the requirements for a cover bandage is must be sterile. Option B is the correct answer. Not only cover bandage requirements, each and every bandage which is the dealing with wounds and burns, anything we have to maintain a sterile techniques, sterile bandage, sterile maintaining also we have to follow. So here the requirements of cover bandage, it should be must sterile. Option B is the correct answer. Next we will move on to question number 60. This is the last question in this video. Purple pulse is indicates to. What is the indication of purple pulse? We will see here option A, injury. Option B, cyanosis. Option C, unconsciousness. Option D, bleeding. Cyanosis is, what is cyanosis? Cyanosis is refers to blue color of the skin. So here purple pulse is indicates to option B, cyanosis. So here not only pulse, cyanosis refers to blue color of the skin and mucous membranes due to the reduced hemoglobin in the capillary blood. Blue skin and lips and veins. Blue skin, lips, mucous membranes, veins is usually caused by low blood oxygen levels or poor circulation. It can be sign of serious problem, severe health issue. This is one of the life threatening problem, and immediately we have to take in medical attention or emergency, call 999. So here the purple pulse is indicates to option B, cyanosis is the correct answer here. This is the last question in this video, part 2 about first aid. We already discussed in part 1 and part 2. Part 1 30 questions and part 2 60 questions, means 31 to 60 questions. 31 to 60 questions we discussed in part 2 video. Next further questions 61 to 100 40 questions we will discuss in the part 3 next video. So friends, thank you so much for watching my video. Anybody watching first time my channel, please subscribe my channel, click on the bell icon. Please like a video, share the video to your friends. Please give a comment. Stay tuned friends. Thank you.